Welcome to NP's Changing Practice. I'm Dr. Carol Berger, and I would like to thank you for joining us today. We are missing Dr. Zimmerman. She is with her husband who's had surgery. So we're asking for anybody listening to please send prayers that Al might recover quickly and that Nina will be sustained through this and help us be returning quickly. So today, what I wanted to talk to you all a little bit about is a journey of self-discovery of my own. I have been taking the first class of the functional medicine certification, and I wanted to tell you a little bit about it and explore their website with you. It truly is eye-opening for me. I did get 38 credits, CEUs for it, so that helps with my certification requirements. You do have to be a provider to be able to take the courses, either an MD, a DO, an NP. I believe there's some new naturopathic doctors as well, some nutritionalists. I've definitely had a variety of different people with the different lectures. I can say the lectures are just fantastic. And I have learned so much more in depth than what I thought I had known. And I've taught pathophysiology for many years. And so I really thought I had a pretty good handle on it, but this goes so far beyond that it really was eye-opening for me in many ways. I'm going to take a moment now to share my screen so you can see a little bit about what I'm talking about. This here is the Institute for Functional Medicine, is where I went. I have no disclaimers. I don't work for them. I just am a student. I've taken one of their courses. Here it tells you a little bit about what they are. They're educators mainly. Let's take a look at some of this stuff. These are all the different, and you can see the credentials. Most of the people that are talking are MDs, DOs that have naturopathic degrees as well. So here's just a listing of the different lectures that you're going to hear, and these are all practicing functional medicine providers. So what does that mean? That just means, like, one of the first classes that we took with functional medicine, they talked about functional medicine being more of a systems disease, systems process, where you look at how one problem might affect multiple systems in the body. And it's trying more to get to the root causes. So let's see, it tells you a little bit about its history, partnerships, and all of that. And then here is what is functional medicine, right? It determines the how and why illness occurs. And the goal of functional medicine is to restore health by addressing those root causes diseases. And this is Mark Hyman. You might have recognized his name. He has several books out with different dietary plans, as well as he has a functional medicine approach. And he'll talk to you about one condition with many causes, one cause with many conditions, talking about how it is an individual patient-centered science-based approach that empowers patients and practitioners to work together to find those underlying causes. One of the things that really impressed me was how they tell the patient's story. One of the first things you might ask a patient if you are taking a functional medicine approach is, when was the last time you felt well? And then you record the patient's journey all the way from like prenatal history on. For example, I was a child who was premature. I was born 2 months early. I had natural delivery. I had exposure to a lot of penicillin when I was younger for different kinds of diseases. That's pretty much how they treated it, was with that. So you would look at all of those things from very young on, and you would also look at trauma that occurred or change, lifestyle changes. Did mom and dad get divorced? Did we move a lot? Was there a death in the family? Were there issues along the way? And you begin to log this out in this graph so that you can see, where did they begin to start having symptoms? And did those symptoms manifest into other diseases as they went along this life journey? And so that's what you're first trying to do, is trying to establish a timeline and understanding all the different causes that might have brought the patient right to where they are today. So this one you can talk, you can go in here. They have functional medicines for residents and medical students, resource centers, how we all get started, scholarships. This is joining the Institute of Functional Medicine, which I am a member of, which gives me access to amazing tools, different tests that I might want to do if I want to explore a little deeper, different diets that I can put people on that might be applicable to them, just a ton of resources, right? And you get 10% off then if you go into the certificate and membership and you go through the courses. This tells you about the certification program, the process of it, the eligibility of it. You do have to take a test at the end. So it's not an easy process, not by any means. It's not like just you take, a little bit of courses online, and the courses are actually quite rigorous. And then you have to work a patient up at the end to make sure you know what you're doing. So they give you a planning calendar, conferences, all of this kind of thing, right? And then one of the things when you join the functional medicine, you take the first course, you also get enrolled in a course that tells you about different physical signs with the skin, the nails, the mouth, that are physical signs of a deeper problem. So that really a lot of great resources. I'm going to stop sharing now and kind of go back. Okay, so that's the site. It's the Institute for Functional Medicine. If you're interested, I really encourage you to check it out. Some of the things like I said, I learned there was first the importance of the provider patient centered story and getting that timeline down, understanding what's going on with them. I learned about a lot of additional tests that could help me assess their nutritional status and how their body was responding to different stressors. We learned about different systems, the adrenals, the kidneys, all different kinds of different systems and how they interact with one another. One of the things that my mom used to always say, and she was so wise, was that if the tummy is not right, nothing is right. And she really was correct in that. And when we look at the microbiome of the gut, it plays a huge part in all of the disease processes. And just finding out that serotonin is larger, the receptors for serotonin, and we produce more serotonin in our gut than we do in our brain, was an eye-opening experience for me. And like I said, the leaky gut, going into the inflammatory markers and how over time and with inflammation and with the different foods that we eat and the different toxins we're exposed to and the different stressors in our life, how this leaky gut can become more and more of a problem at a cellular level. We learn about what's happening, and then we look at the evidence, and they provide you with all of the scientific studies that you can then look at in your leisure to see, if this really supports this or not. And I found out a ton about food and how we should really look at food as our first medicine. From a functional medicine perspective, we're trying to find the root cause of whatever the problem is. So we're not going to just gloss over yet by just treating the problem, but we're going to try to find out what is causing the problem so we can reverse it or heal it to whatever degree we can, and then eventually come off of the medicines if we can, right? That's our goal. We talked a lot about work-life balance, and there was a wonderful presentation by a nurse practitioner who provides functional medicine, and she talks about that patient relationship, that bond, that empathy, research that shows how much empathy influences our patient's health, the power of touch, the influence. We can actually influence the heartbeat around those around us just by our energy field and the evidence that's behind that. And we certainly have seen the power of touch and isolationism, what happened during COVID. We saw that up close and personal. So that's real. And we have to realize that by really connecting with our patients, we will be able to help themselves much better. We talked a lot about inflammatory responses, like I said, and different things that affect it, oral hygiene, how that affects. I mean, that's the gateway to the gut biome, right? And if you have a lot of oral disease, it affects cardiac function. It affects many other things. We talked about mitochondrial health and how, we normally think of the mitochondria, that patient that just always says they're fatigued, they're tired, and we can't find anything that's wrong with them. Maybe having damaged mitochondria versus, rather than making 32 ATP under the influence of oxygen, right? That's making less, it's making 15 or 16 ATP. So they are chronically tired because they're like always running on a gas half full. And it's just wearing them out all the time. And there are foods and different approaches that we can take to build that mito health. So lots of natural remedies, lots of testing that I was unaware of, to be able to help me to really dig into what was going on with the patient. So I'd encourage any of you that are thinking about getting some CEUs for your certification to take a look at the Institute for Functional Medicine and try to figure out if that would be something that you might be interested in. We appreciate your support and watching and listening to our videos and podcasts. As always, continue being nurse practitioners who are changing practice, and we look forward to seeing you again next week.